Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. Friends, we are discussing about treatment of nephrotic syndrome in Ayurveda, and today we will discuss the Ayurveda management principles in the case of minimal change in nephrotic syndrome. The first line of treatment is Nidana Parivarjana. Second line of treatment is correction of the Agni. Third line of treatment is treatment of Amapachana. Fourth line of treatment is treatment of Medovaha Shotodoshti. Fifth line of treatment is Vojo Vidramsa, treatment of Vojo Vidramsa or Vojo Vyapat. Next is treatment of Ojokshaya if the patient comes to you in the steroid dependent cases. Treatment of Udakavaha Shotodoshti. Treatment principle of Mutrala Chikitsa. Prevention of recurrent respiratory tract infections. Use of Rasayana specific to Vrika, diet restriction, psychological treatment, and Pathya. So these are generally the treatment principles that we have to follow in case of nephrotic syndrome when you are treating a case in terms of Ayurveda. So all these treatment principles should be kept in mind. Okay, a single drug may be serving different effects also. A drug which is Amapachana may be also sometimes Medohara, sometimes same will be also Udakadoshahara. So such drugs we have to select and minimize the prescription. Prescription should not be too much, it should be minimized. So that we will discuss in the coming classes. Now, first line of treatment is Amapachana treatment. So we know that what is the role of Ama in the manifestation of a disease nephrotic syndrome. So therefore, always the first line of treatment is Amapachana treatment. Ama which is present in the Dhatu level should be clear. To clear it, we have to go for vigorous Amapachana treatment daily. Okay, daily Ama will be formed and daily that Ama should be cleared. That should be vigorously done. So common Amapachana drugs which can be used are starting from the very simple drugs like Shunti, Maricha, Musta, etc. You can also go for Panchakola Churna. You can also go for Chitrakasava, Chitrakadi Vati, etc. can be used. But if the disease is a little chronic and if you think that Ama is very deeply rooted, then we can use some of the very specific drug like Arogyavardhini Rasa, Agnitundi Vati, Rajanyadi Churna or Ajamodari Churna, etc. So these drugs helpful to clear the Ama which is deeply seated. Now, a long-term and continuous Amapachana drug is must throughout. Whenever you are giving treatment for a nephrotic syndrome, go for continuous Amapachana drugs because Ama is daily get formed and daily that Ama should be get cleared. If that Ama is not cleared, that itself is going to exert an antigenic effects over the immune system and immune exaggeration will going to take place. So any other palatable or easily tolerable Amapachana drugs can be used as for the convenience. Preferably the drug which you are using as Amapachana, if it has got Deepana property also, then it's very good. Deepana and Amapachana both. If the properties are there in a single drug, that is very good. We have got many drugs like Chitraka. Now, second line of treatment is treatment of Medovaha Shotodoshti. Treatment principles I have explained in the beginning. These are the specific treatments. Now, Shoto Shodhana drugs are very important. We know the involvement of the Medovaha Shotos here and how it is involved. And the Vrika is formed by Kapha, Medha, Shonita Prabhava. Embryologically, Vrika is formed by Kapha, Medha and Shonita Prabhava. So we need to give those drugs which will going to stabilize these three factors. See, all the three factors are directly related to the body immunity. Again, Kapha, Medha and Shonita Prabhava is Vrika. That Vrika is affected in nephrotic syndrome. So drugs which will going to help to stabilize these three Kapha, Medha and Shonita should be given. So we know that Mula of the Vrika, so renal protective, Mula is Vrika, so we have to go for renal protective drugs in terms of Ayurveda. So what are the renal protective drugs that which can be prescribed? That is like starting from Chandraprabhavati, Gokshradivati and Punarnama preparations are better used. Punarnama is known for Punarnavayati iti Punarnama. It will go to regenerate the things. Okay, this is one part. Second is as a Medas is the involvement. And to clear the methods, we can go for the Kshara preparations. So Kshara preparation should not be used in excess. That should be kept in mind because nephrotic syndrome is a condition which requires long-term treatment. So continuous Kshara preparation is not indicated. However, Kshara preparation be given. We have tried with the Ksharabasti in some of the cases, but Ksharabasti is not much useful in nephrotic syndrome. One is the limitation is age of the child also. Otherwise, best thing is to control the Medo Vashoto Dushti is Gugulu preparations. Gugulu is a Medo Kafahara. So it will tackle both the things. So Gugulu preparations can be given. Drugs which stabilize the Medo Dhatu, like Navaka Gugulu can be given, Kanchanara Gugulu can be given, Trayodoshanga Gugulu can be given, all, even the Shilojitu preparations can be also given judiciously. No problem. But treatment should be given to correct the Medo Vahashoto Dusti. Third line of treatment is Ojho Vardhaka treatment, enhancing the immunity. Now, modulate or educate the immune system to control the exaggerated reaction. Now, you need to, here immune system is not depressed. Here immune system is not weak. Here immune system is overexcited. That means immune system is overacting. It is showing an exaggerated responses for a simple stimulus also. So now you need to educate the immune system that you should not exaggerate too much, or you should show the limited response, or you should not show advanced response. So that itself is the problem here. Okay, when the immune system is exaggerated, the autoantibodies are formed and they are disturbing. So now to correct that, Ojas has to be corrected. The aberration of the Ojas, Ojo Visramsa or Ojo Vyapat, that has to be corrected. Okay, so what is the best thing that you can do to correct the Ojas is Satvika Ahara. Sattvam Tatapi Chaha. So you should give this Satvika Ahara should be offered to the child. Okay, usually relapse occur after a viral attack when immune system is stimulated. See, all the viral infections, they will go into cause sudden surge of the chemicals. As a result, immune system is suddenly get excited. So such a sudden excitement of the immune system may lead to exaggerated reactions. So thing is, we have to prevent such a recurrent respiratory tract infection. So diet and drugs which are similar to the qualities of the Ojas should be taken. It may be Snigdha, Madhura, then comes Prasada, Guru, Shita and Prasanna, etc. Qualities of the Ojas. The drugs which are having these qualities should be inculcated in the daily diet pattern of the child. Vrisha drugs can be also to some extent explained. Now, what are the most common drugs which are used for Ojo Vardhaka treatment? Apart from Satvika diet and Satvika Ahara Vihara, the other drugs like Guduchi is there, Punarnava is there, Pippali is there, Ashwagandha is there, Yashtimadu is there. So these are the drugs. Yashtimadu is also Vayastapana and all. So that has got multifaceted activity. Okay. So these drugs should be given. Now how we will give these drugs? These drugs can be given in the churna form. If the patient is not taking in the churna, child is reluctant to take the churna, then you can use the Kshirapaka method. Take different types of Ojo Vardhaka treatment. Brahmaniya, Jivaniya and Balya drugs are taken. Vayasthapana drugs are taken, Ojo Vardhaka drugs are taken, and then it should be made into the Kshirapaka method, and Kshirapaka you can offer to the child. Next, immune modulation through the diet and regimen. The Shadrasayukta Ahara should be given. See, we have to increase the Ojas, isn't it? We have to correct the Ojas. We have to correct the aberration of the Ojas. So we can use the immunomodulated drugs. I mentioned Guduchi, Pippali, then Punarnava, Ashwagandha, so many immunomodulated drugs I have mentioned. That should be given in the Kshirapaka form. Apart from that, you have to correct the diet also. Shadrasayukta Ahara should be given. Satvika food should be given like Kshira and Grita. Nitya Kshira Grita Sevana should be done. Then avoid Ajirna. Ajirna itself is the root cause again for formation of the ama, and follow the follow the rules of food intake. Avoid Paryushita Asatmya Ahara. Nowadays, junk food, okay, outside food, junk food, stored food, packed food, etc. So avoid Paryushita Asatmya Ahara. Then go for the proper exercise. Follow the Sadvrutta, Swastavritta, faith therapy, yoga, and pranayama. Why I am explaining is these are all the things which will go into increase your Ojas. Okay. So first it corrects your manas sattva, and then it's going to increase your Ojas. Once the Ojas is corrected, the immunity, the hyper exaggeration of the immune system is get corrected, and that itself is the root of a treatment. Now in the next part we will see the next part of the treatment that we will see in the next class. Thank you very much.